Non-steroidal anti-inflammatory drugs do not correct the problem. Now, before anybody crucifies me on here and says, we know that already, we know that it doesn't fix the problem. I know you might know that, but some people don't. Some people need to understand that these medications, non-steroidal anti-inflammatory medications, Advil, ibuprofen, things along those lines. You could do just a quick search on Google. What are non-steroidal anti-inflammatory drugs? It'll give you a list of them. Celebrex. They reduce inflammation. And therefore they can help relieve pain. The problem and the reason I want to talk about this is because there's a huge problem with them is that they have a big negative effect on the health of your gut lining. And if we have a problem with the health of your gut lining, over time, that's going to create a bigger inflammatory problem throughout your whole body. So the problem you're trying to solve with that medication is creating another problem that will be bigger than the problem you're trying to solve. So if your idea is that those are fixing the problem, just please don't have that idea because it's not true. They are covering up the underlying issue. Find out what that underlying issue is. Work at resolving that, all right? One of the main reasons people come to see us, we hear it all the time. I heard it yesterday twice. I came to see you. Somebody traveled from pretty far out of town, all the way up in Kentucky, which it's not millions of miles away, but it's a couple hours. And they said, we came to Magnolia because we know that you guys do testing. We know that you're aggressive about testing to find out what's wrong with somebody. Go to somebody who's willing to be aggressive, not go, run a couple lab tests or do a couple things and then go, we don't know, here's a medication. Or they're not willing to do the testing at all because they think they already know what the problem is, so they prescribe based on what they think it is rather than actually doing the research to find out what it really is. Anyway, I don't want to go on and on about this. Non-steroidal anti-inflammatory drugs are really bad for your gut. They're also bad for your liver, and they contribute to long-term systemic problems. You should do what you can to avoid them. I'm Dr. Dave Morris at Magnolia Medical Center. I'm here on my rehab floor. We do a lot of physical therapy, physical rehab, functional movement, functional rehab. I have my chiropractor. He works over in front of me here. We do a lot of other modalities here to try to help get people well without the use of drugs and surgery. I hope you found this helpful. It's our passion to help people get well, and people need this information. Leave me some likes, leave me some comments, and hit the share button and hit the follow button. Take care.